Hello, my name is Nicole Graham. This is my video submission for the Healthcare Career Photography Competition. For my first picture, I chose Brenda Peters, APRN CPNP. She works in pediatrics. For her to become an APRN CPNP, she had to obtain an Associate of Science in Nursing or a Bachelor of Science in Nursing. Ms. Peters also had to obtain certification as a pediatric nurse through the Pediatric Nurse Certification Board. In the picture, Ms. Peters is performing a well child checkup. She is using a stethoscope to listen to the baby breathe. Ms. Peters is checking to make sure the baby is breathing normal and is not irregular. Ms. Peters is also seeing how well the baby's strength is because having the baby in a sitting position, the baby is having to hold her head up on her own. Mrs. Peters' profession, APRN CPNP, fits into the healthcare system because she can evaluate the growth and development of a baby in the areas of motor skills, language, and social skills. Mrs. Peters also knows when it is time for a baby to receive the necessary immunizations to help keep the baby healthy. She also knows how to help parents with medical advice when there are concerns. For my second picture, I chose Gary Nichols, ultrasound technologist. For him to become an ultrasound technologist, he had to complete a certified program in an associate's degree or a bachelor's degree in ultrasound technology. Mr. Nichols also had to become certified through the American Registry of Diagnostic Medical Sonography. In the picture, Mr. Nichols is performing an ultrasound on a female's heart. An ultrasound of the heart shows how your heart muscles and valves are working. An ultrasound can help a physician to determine if the heart is working properly. Mr. Nichols must pay attention to the monitor to make sure the images he takes will be clear enough to show any abnormalities. He also must make sure he gets enough images to help with diagnosing any issues. Mr. Nichols' profession, ultrasound technologist, fits into the healthcare system because he can help physicians and other health professionals diagnose patients' ailments. He alerts appropriate medical staff of any abnormalities that need immediate attention. Mr. Nichols, just as other healthcare professionals, must maintain a strict level of confidentiality. For my last picture, I chose Jason Snyder, physical therapist. For him to become a physical therapist, he had to earn a bachelor's degree in a health-related field. Mr. Snyder's had to complete a Doctor of Physical Therapy degree program. He also had to meet the state of Oklahoma's licensing requirements. In the picture, Mr. Snyder is measuring the patient's range of motion in her arm. Range of motion is a measurement around a joint. The patient in the photo had an injury to her arm, and Mr. Snyder was measuring to see how she was doing since starting the range of motion exercises. Mr. Snyder's profession, physical therapist, fits into the healthcare system because he helps physicians diagnose possible problems that a patient has with joints such as shoulders, knees, and elbows. He works with physicians to help develop a plan of action to help a patient get better. The three photos that I chose are extremely helpful in the healthcare field. They show three different types of professions that work closely with people throughout the healthcare industry. These three fields can all work together to help patients receive the treatment they need, and they all do their part to help a patient get better. Thank you.